We have now removed part of the investing fascial layer on the right side. We have also mobilized the platysma on the left side, and part of the investing fascia as well was removed from this side. So that's the sternocleidomastoid muscle. Once again, you can see the sternal head, the clavicular head, and the mastoid head is up there. And again, I would like to point out this triangular shape depression that it forms, especially when the sternocleidomastoid muscle is contracted. Now this SCM, sternocleidomastoid muscles, they move the head, obviously. When muscles on both sides are contracting, it causes flexion of the head. Your head will be bowed down towards the chest. So sometimes the muscle is called prayer muscle, but acting unilaterally. If only the left sternocleidomastoid muscle is contracted, the head will turn towards the opposite side. So muscle on the left contracting, the head turns contralateral side. Why? Because it will pull the superior attachment point. It will pull the mastoid process anteriorly. So your head will swing or turn to the opposite side of the mastoid process that is getting pulled anteriorly. So let's go back here to the right side. With part of the investing fascia removed, we can now see the boundaries of the smaller triangle that are part of the anterior triangle and posterior triangle. Let's start with the posterior neck triangle with fewer subdivisions. So large posterior triangle. Now one subdivision of that triangle is the supraclavicular triangle down here. Boundary of the supraclavicular triangle, the clavicle as its base. Then we have the sternocleidomastoid muscle, and this muscle right here, that's the inferior belly of the omohyoid. That is the third boundary of our supraclavicular triangle. So the larger component triangle of the posterior neck triangle is the it's in the tip of my tongue. Just review from your book. Suboccipital. This is the suboccipital triangle. It is bounded posteriorly by the trapezius muscle. Then another boundary is the inferior belly of the omohyoid muscle, and the third boundary is the sternocleidomastoid muscle. So we can see right here once again the external jugular vein. Again, it starts near the area of the angle of the mandible. It goes down, crossing the sternocleidomastoid muscle perpendicularly. Now that is a clinically important vein because we can use the vein for IV access, intravenous access. We can insert an IV line right there. We can insert monitoring catheters, etc. Another thing is when we perform physical examination, if the patient has a heart failure, what will happen? No? You can observe engorgement of the external jugular vein. No? Normally, it should not be engorged, or it should be engorged just a little right above the clavicle. But if the heart is failing, if the heart cannot push blood going to the lungs or going out into the systemic circulation, blood will dam on the venous side of the circulation, and it will pool, no, in the vessels that drain into the superior vena cava. One vessel that will become engorged, no, will be the external jugular vein. No? So engorgement of the vein, no, is it is severely engorged, no, and as one of the signs of heart failure, we call that Kussmaul sign. Kussmaul, Kussmaul. So, okay. Now let's go to the anterior neck triangle. The anterior neck triangle has more subdivisions. No? So let's start with the more superior subdivisions. No? So again, this one is the submandibular salivary gland. So this one is the digastric triangle. No? That's this digastric or the submandibular triangle. So boundaries will be the inferior margin of the mandible, the anterior belly of the digastric muscle. That muscle right there is the anterior belly of the digastric, and the third boundary is the posterior belly of digastric muscle, which is still covered partly by the submandibular gland right here, but the muscle is positioned like that, no? So you have a triangle right there, submandibular or digastric, no? Named after two of its boundaries. Here we have another triangle here, no? We have the submental triangle. The boundaries of the submental triangle will be the anterior belly of digastric, the hyoid bone. Actually, the hyoid bone is now palpable but not yet complete. It's partly visible right there, no? So hyoid bone, anterior belly of the digastric muscle, and the midline of the neck, no? But some books will describe the submental triangle as this bigger triangle right here, instead of the midline of the neck as one of its borders. No, it will take the two. It will make the two anterior bellies of digastric muscles on both sides as the lateral boundaries, and the hyoid bone as the base of the triangle. So that's the laryngeal prominence right there. So there is a connective tissue membrane, no? In between the hyoid bone and the thyroid cartilage. Now, the laryngeal prominence is protuberance or prominent part of the laryngeal cartilage of the larynx.